Here we will draw the brainstem arterial vascular supply. We will begin with the common 4 brainstem arterial territories. First, draw 1/2 of an axial composite of the brainstem, a compression of all 3 brainstem levels. Then designate the thin paramedian region as the anteromedial group. Now divide the remainder of the brainstem from anterior to posterior into the anterolateral, lateral, and posterior groups. Next, we will make a table of the specific vessels that supply the brainstem. Note that although our list will not be exhaustive, it will cover the majority of the relevant arteries. First, indicate that within the medulla, the anteromedial group is supplied by the anterior spinal artery and direct vertebral artery branches. The anterolateral group is supplied by the anterior spinal artery and the posterior inferior cerebellar arteries. The lateral group is supplied by the posterior inferior cerebellar artery, and the posterior group is supplied by the posterior inferior cerebellar and posterior spinal arteries. Now encircle the key medullary arterial vessels, the anterior spinal artery and the posterior inferior cerebellar arteries. Next, note that the common source for these arteries is the vertebral arteries. As a clinical corollary, ischemia to the posterior inferior cerebellar artery results in lateral medullary syndrome called Wallenberg syndrome. Now let's label the pontine arteries. The first 3 groups are supplied by basilar branches that travel progressively farther distances to their targets. Indicate that the anteromedial group is supplied by the pontine paramedian arteries. The anterolateral group is supplied by the short pontine circumferential arteries. The lateral group is supplied by the long pontine circumferential arteries and the anterior inferior cerebellar arteries. And lastly, indicate that the posterior group is supplied by the superior cerebellar arteries. Note that the posterior group is only found in the upper pons. It is not present in the mid or lower pons. Thus, most of the pontine arterial supply comes in the form of circumferential arteries that originate from the basilar and either travel a short distance, the paramedian pontine arteries, a mid-distance, the short pontine circumferential arteries, or a long distance, the long pontine circumferential arteries. The posterior portion of the pons receives additional supply from the anterior inferior cerebellar artery inferiorly and the superior cerebellar artery superiorly. Note that the common source for these arteries is the basilar artery. Basilar ischemia can produce pontine basis strokes, which can cause locked-in syndrome. Next, let's label the midbrain arteries. The anteromedial group is supplied by basilar tip and proximal posterior cerebral artery branches. Indicate that from inferior to superior, they are the inferior and superior paramedian mesencephalic arteries and the thalamoperforate arteries. Then show that the anterolateral group is supplied by posterior cerebral artery branches, the collicular and medial posterior choroidal arteries. Next, indicate that the lateral and posterior groups are also supplied by the collicular and posteromedial choroidal arteries in concert with the superior cerebellar arteries. Now let's encircle the key arteries that supply the midbrain, the paramedian mesencephalic and thalamoperforating arteries, and the collicular, posteromedial choroidal, and superior cerebellar arteries. Note that the common source for these arteries is the posterior cerebral arteries or distal basilar artery. When basilar clot produces ischemia to the proximal posterior cerebral arteries, large midbrain strokes can occur and produce a so-called top of the basilar syndrome. This concludes our diagram.